talking earlier on before we started the interview, what this experience meant to you. And you mentioned it earlier on as an outsider. How does that impact you personally?
Well, on a very personal level, I mean, it's an honor to be able to be involved in an essential health service delivery program addressing the scourge that malaria was. I mean, when we entered in Equatorial Guinea in late 2003, no matter who you met, they talked about the number of episodes of malaria they had a year. You could visit the local cemeteries and see the tombstones of infants and young children who had died as a result of malaria. Everybody was touched by it, and so it was a visceral, direct story of everybody that we worked with. And to see that change so drastically as a result of this incredible partnership has been a blessing. I mean, it's, one hopes when one goes into international development work that this is what you're going to have an opportunity to do. But honestly, for a non-governmental organization like Medical Care Development, I think to have had the opportunity to be at the table with and engaged in an activity that is not just a pilot project or a 2 to 3 year activity. This is a 15 and now 20-year commitment by the government and by the oil companies. We've had an opportunity to not only do this on an experimental basis to show and get a proof of concept and show new technologies, we've had an opportunity to take this to scale. And because of the foresight of government and because the institutional wherewithal within government, the statutory authority, the legal construct, the institutional mechanism, and the public finance mechanisms are there, what we've been working on as a project has become part of the National Malaria Control Program, and as the Vice Minister has said, it's become part of policy. That means it's scaled and it's sustainable, and I think that's really the hallmark of this program.
So this program, you will be able to implement the scheme that you use into other aspects of healthcare in the sector.
Definitely, because the insight we had as implementing the malaria program, as you can imagine, we have gone through 2 prior clinical trials now with the malaria vaccine, and the 3rd one is underway, and we have had massive data to understand the epidemiology of the people. So their institute is being developed, the research institute, as a consequence, because we are learning more about the epidemiology, and we are starting to think how we can have the highest impact on our people's best health delivery, because malaria is just one piece of that have helped us understand and get into contact with the community and how their community interact each other and how to best approach the community in order to improve their health services. I think all that knowledge coupled with the cadre of expertise in the scientific field give us a unique opportunity to design something that will help us move toward universal health care and also to improve the quality of those services.
Okay, you mentioned data, which is very, very unique in Africa in all aspects, not just in the healthcare industry, because there is no data regarding diseases and how to take care of those things. And that's one of the issues that you're currently working on right now. So my question to you is, in general, in DRC, for example, and in 2014, when the Ebola broke out, there were a lot of issues in trying to get the community involved. And so how did you go about convincing the community that this is right for them? Because in most cases, people are like, Africans are very skeptical when it comes to things like that. Yeah. And that's been the issue in DRC in particular, like regarding vaccination, like, oh no, I don't want to get this. So how did you go about convincing the community that this is good for them and on the long term? And what lesson can other African ministers, African leaders, what lessons can they learn from your experience?
I think in a project like this where you have multiple sources of support or partners intervention, it's very important that they understand the cultural context. I think this is where the role of the government comes, and which is very important. The role of the government should be to situate the synergy that is coming from the global level to contextualize it at the country level, and to understand what is the mindset, what is the culture of the people, so that the intervention are very culturally attuned with what is going sociologically speaking. So in that context, we have been a vehicle to make sure that we don't do anything that is counterproductive to cultural sensitivity. So we make sure that we will understand how people think, how they perceive about certain intervention, and we will make sure that we will talk to key figures within the community. I think the parliamentarians are very important to that scheme of stakeholders. We will go to the community and select people who are also coming from that community to become champions within their own community, and make sure that they will be the one to get all the concern, so that we will address and take the time to address those concerns so that everybody is comfortable, and that's what we are doing. I think that to take the time to understand and go through and walk the people through that process is even more important, because it shouldn't be the pressure of time by getting what you're trying to do, but getting there in the right way with everybody that is required. So it's important that the committee is a certain piece of everything that we're doing. That's why we invest that amount of time, so that everybody understands what we are trying to do.
How much of your GDP are you spending on the healthcare sectors right now?
Right now we are spending in 3.7, the official figure, but there's more to that. So we are trying to compile, we are working on an exercise, because there are a lot of investment that is going to health from the private party that is not counted on that statistic. However, the 3.7 is still above what African countries are investing. The recommendation is to invest close to 7, so I would say we are halfway at the current moment.
Okay.
Yeah.
President Kagame, when he was the president of the African Union, one thing he said was health is currency. And congratulations on winning the award. And we hope other African leaders we understand that health is currency, and without a good healthy population you can't have a good economy.
Exactly.
So the turnaround of Africa, continue the work that you're doing, and thank you so much for the work that you're doing, and the partnership. Thank you.
Thank you.
It's an honor.
Thanks. Yeah.